I titled the talk Youth Soccer Injury Prevention and Introductory Talk, not lecture, because I hope that we can have some, interaction at least midway or towards the latter part of the session and get some exchange between ourselves, coaches, and parents or players with any specific questions they might have, but also the introductory part being critical as well, because I hope this is just the start of future conversations and sessions and workshops which we can have. So I think good place to start is just to introduce myself. My name is Dr. James Bullock. I am an orthopedic surgeon who I have done additional subspecialty training, that's fellowship training, after completing my orthopedic residency in sports medicine, technically sports medicine, as well as shoulder surgery, because that's a particular subset of orthopedics I'm very passionate about. Sports was an integral and still is an integral part of my life. And I think it has tremendous value to the society and to the athlete and everyone involved. And I love taking care of athletes and dealing with injuries. But our talk today is actually hopefully preventing injuries, or at best minimizing the occurrence of injuries. So, just to give a little background on myself, I grew up in Kingston, Jamaica, and I did play soccer, some in elementary school and in high school, about halfway through high school, as well as playing other sports. I have Brazil up here because where I grew up in Jamaica, you pretty much you had to make a choice at the time when I was a young kid, whether you're a Brazil or Argentina fan at the time in the late 80s. And so on my block, I was probably one of two Brazil fans, and we were surrounded by Argentina fans. Anyway, and then I have up here the historic match where Jamaica managed to hold Mexico to a 0-0 draw, which was the first time we made it to the World Cup. And unfortunately, I haven't made it back since, but hopefully that will change again in the future. So to launch into what we're talking about today, I just want to give a little background, and then we can go over a few specific injuries. The talk today is not meant to necessarily be about one particular injury, although there are a few things which will come up recurringly. If there are any questions at the end pertaining to a particular injury or injury pattern or trends which anyone's seen that we can address, certainly. And what I'm hoping is that in the future, we'll have some workshops that will involve myself and even potentially some physical therapists from our office, maybe some of the other physicians, and we can really get to interact in person, hopefully, and have some meaningful exchange of information, which we have helped to analyze some things which may be going on. So really going beyond the situation where I'm just a surgeon or the sports medicine physician taking care of one athlete, but looking towards the overall health and wellness of your players in your program, and to the parents, your children. And one thing I didn't mention from the prior slide is I am a parent myself. I have two kids, a daughter who's in gymnastics, and my son who's trying out a lot of sports now, currently in basketball, just finished the rec soccer season, plays tennis and some other stuff. So, keeping young athletes healthy is not just something that's important for me professionally, but for my personal life. As we know, the popularity in soccer soared, especially around the time when the US hosted the World Cup. There's been some leveling off of that, but when you look at youth soccer participation, over 3 million players in the US. I don't know what the most current data on that is, but tremendously popular team sport, both for girls and boys. And obviously we know the global popularity of soccer is tremendous, especially in countries where you're not competing with some of the sports which we are here. Everybody knows that the impact of injuries is without doubt devastating. And as a treating clinician, it does not bring one joy. No matter how much you like to take care of a particular injury, you're taking care of an athlete who has that injury, and you have to think about, all the negative impacts that injury can bring, socially, physically, the impact on the family, the alteration in the usual routine which an athlete is in between school and the team participation. So it takes the fun out of the game. No one wants to see someone get injured. You lose the social benefits of play. And that goes from, just the child who's playing rec, soccer a couple weeks a year and seeing their teammates for that time, but forming bonds that they could have going beyond that, as much as a kid who's, a teenager who's in a competitive travel league. And so the social benefits are tremendous. The loss of the physical wellness and the benefits of the game obviously go along with injury. And most importantly, the pain and the loss of function that that athlete has. And unfortunately, some of these injuries, that loss of function can go beyond even their competitive years in the sport. So how much of a problem is this? It obviously can be difficult to measure or quantify, and studies probably vastly underestimate the frequency and incidence of injury, because that will depend a lot on what the reporting mechanisms are in place. If you're only going to count kids that end up in the ER, from a soccer match taken in by an ambulance or by a parent, you're going to grossly underestimate the injuries. And if you're only looking at stuff that happens in competition as well, you're going to grossly underestimate it. So clearly, it's a significant problem. There have been a lot of studies that try to analyze, well, where do kids get injured more? And not just kids, but even, older people playing soccer. And it tends to be more so in games than training. Incidents of injuries vary as much as, 2 occurrences per 1,000 exposures or 1,000 hours of exposure, to as much as 50 in some studies. And you might be like, well, what does that mean for my kid or my team? Some studies look at it in a more palatable situation like that and say, look, if you have a soccer team, training throughout the season, it's likely that there might be anywhere from 2 to 3 injuries, per season on the team. And that's not just minor bumps and scrapes come back the next day, but injuries which require some time out, even more than 21 days. So the incidence of injuries occurs both in male and female youth players. Certain injuries have very similar incidents, and then some injuries, such as ACL injuries, are unfortunately more common in young female players. And that goes, for ACLs across sports, not just soccer, anywhere as much as 2 to 6 times as often in some studies. It appears from most studies that the injury incidence increases with age, and that's not necessarily correlating with skill level, because they look at skill level as well. And the studies, some studies will show that as the athletes get more skilled, the injury incidence is less. But what happens in the higher skill levels is these players tend to be playing more, and so the actual number of injuries end up being similar, even though the rate of injury per hours exposed to the sport is less. So I think what's important when we kind of get out of all of this, highfalutin data and trying to figure out, well, what does that mean for our program or our team, is, we should be tracking these things and keeping a record of it. So what types of injuries are there in soccer? Obviously, there's an acute injury where kid was healthy, training or playing, and something happens and it's a drastic change. The vast majority of those injuries tend to be what we call contact injuries, where one player collides with another, someone's tackled, for example, or even an unintentional, contact. Two people going for the ball, not quite aware of each other, and someone gets hurt. Um, the unfortunate thing is that as much as a quarter of those contact injuries, especially in gameplay, can often be from foul play, so illegal play. And we'll get into that a bit more. Overuse injuries tend to make up about a third. And now that level, those statistics are going to change a bit depending on the age, how much kids are practicing, and so on. The severity of the injuries obviously varies significantly. Most soccer injuries tend to be lower limb. In most studies, 60 to 90%, which you would expect. And then concussion is something which, we have to bear in mind as well. It's certainly gotten a lot of attention in the last 5 to 10 years, which is important. A lot of that through other sports such as American football, but we know this happens as well as in soccer. Fortunately and reassuringly for parents, the incidence in youth soccer of concussion is relatively low, although some studies show it's increasing. But as a parent, you don't care what the incidence is if the child that's counted in that is yours. And so it's something worth discussing and talking about how we can reduce that. Concussion appears to occur more in the female youth soccer player as well. And then in terms of overuse injuries, there's a variety of these. It could be, tendonitis, so overuse injuries. The patella tendon is one particular site, or the Achilles tendon is another. Kids can simply have pain at the kneecap, what we call patellofemoral pain. One that we're probably very familiar with, especially in the 12 to 14-year-old age range, is growing pains, or Osgood-Schlatter disease, which is the growth plate at the top front part of the shin bone, is under some stress from the repetitive kicking activities and running, and responds to that, and it can get inflamed. And in this drawing which we have here, a similar thing can occur at the heel, and that's called Sever's apophysitis, or growth plate inflammation. So these are all different sites, and there are things to pay attention to. And overuse injuries tend to have a trajectory. First, it's typically the kid complains of discomfort at the end of practice or the end of a game, and it tends to go away by the next day. And then it starts to be, while they're playing, they're hurting, but it's not really affecting their performance. And then it's hurting when they're playing, and it's affecting their performance. And then the last stage of that is they're unable to play. And so obviously we want to address these things in the earlier stages. And sometimes it can be difficult, especially in the older kids that might not want to tell you. And that's why the coaches come in, when especially they'll start to notice if there's a performance change. In terms of severe injuries, what's most common and what comes to most people's mind are injuries about the knee. That's the most commonly injured site in season-ending injuries, or injuries that require more than a month out. And they're obviously, from the amateur and youth level all the way up to the professional level, ACL injuries. And oftentimes it's not just the ACL or anterior cruciate ligament, but other parts which are affected. Obviously, we've seen, severe things like fractures and so on, but fortunately those are not as common. It tends to be the ligamentous issues, but which can take a long time to recover and have long-term, effects. Environmental injury is not something we necessarily think about a lot, but especially here in South Florida, heat illness. So there's severity of heat illness. It can start as heat cramps. The athlete feels like, they're starting to cramp up, but overall, metabolically, they're doing okay. That will usually resolve with some, cease of play, stretching, rest, rehydration. No long-term detriment. Heat exhaustion is a a different situation where it's not just body area that's feeling the effects of playing under rough circumstances, but they start to have cardiovascular effects. Their heart cannot keep up with the demand which is necessary to try and get rid of the heat from the body, as well as supplying the muscles and the brain with the blood supply they need to bring the oxygen. And then, the most severe stage of that is heat stroke, if those things go undetected. And that's a life-threatening thing. And, that's diagnosed technically when the core body temperature is above 104 degrees. And that's a medical emergency. And hopefully we're never at that point, but certainly can occur. I remember covering when I was in medical school, a Chicago marathon that actually had to be called off because there were several runners that started to faint, pass out, had to be taken away in an ambulance, and they actually had to call off the race. Now, most of the high-level runners had already gone through, but there were still some pretty avid runners, and I felt it for a lot of these people who were like 2 miles away from finishing, and the race had to be called off. And then lightning, which is something where we certainly need to be mindful of, and there's a lot of technology to help with that, and we'll talk about reducing the injury risk with some of the lightning stuff. Field material is a hot topic in soccer and other sports like American football, and there's been a lot of research in terms of turf versus grass. And in terms of ACL injuries, a lot of studies have shown that grass actually has higher injury risk for training, but both surfaces have similar game injury risks, but there are multiple factors. You have to look at the shoe to playing surface interface, and this is where it's important to check and make sure the child has the right cleats, that the cleats are not worn down. You don't want to have too much friction because that can cause a foot to remain planted in whatever surface and risk ankle and knee injuries, twisting injuries. They can decelerate too rapidly, for example. And on the flip side, if there's poor grip, then other injuries can occur, rapid change and stretches in the muscles. So, it's a balance. So injury risk factors, the most consistent and strongest risk, sorry, I wrote risk twice, factor for future injury is a prior injury. And so that's why it's worth our time on a Monday evening, to talk about this, because, prevention is better than cure. And even something which is seemingly a minor injury, it can put the athlete at risk for having future injuries in that area and other more severe injuries. So the best thing to do is minimize the injury risk. That's the number one risk factor, because with ACL, with hamstring strains, the biggest risk factor is having had a prior injury at the site. Age, the injury risk generally seems to increase with age for most youth soccer injuries. The competition level, like I said, the higher skill levels seem to have reduced injury per exposure, but they typically have a higher volume, and so the injury frequency actually tends to equate when you're looking across a team. But obviously having the requisite skill to participate and compete at a certain level is important, and that's why you have excellent coaches. This is, this particular pictograph here is a push from the sports academy within the Orthopedic Society, the Pediatric Orthopedic Society as well. It's a stop injuries, push, and there's a real push to avoid sports specialization, early sports specialization especially. This tends to come up a lot more commonly in baseball, for example, when kids are throwing with, one arm doing a particular kind of throw all the time. But it's something we have to think about as well in soccer. And, hopefully the child has opportunities to do other stuff, but it doesn't mean that a child can't be serious with a sport if they do another sport. What you have to be mindful of is, making sure that they're not overtraining when you combine the two. But there's benefits to cross training, and it doesn't mean that if they play soccer, then they have to go and do competitive basketball. It could be something as simple as, well, in the off season, they're going to do some swimming as well, recreationally or something like that. So it's something to bear in mind, because it is shown to have negative impact on injury risk. And in the vast majority of studies, being the star at age 10 doesn't often translate into the kid who's going to get a scholarship. Those kids sometimes burn out. So there's a balance. And I think this is where coaches and parents really have to come in, because sometimes you might have a child that's really enthusiastic about one sport and doesn't wish to play another. And it's something that I think about as well, because my daughter does gymnastics, and that's pretty time consuming. I think, well, at least they're developing multiple skills. We all have our excuses for why it's okay in our situation, but studies have shown this. So, try and encourage your child to do something. It doesn't have to be competitive like they are in soccer. Overtraining. So what does that mean? Prolonged excessive activity. There's a rough guide that's utilized that says the child should not be participating in organized sports activities, whether that's training and competition, for more hours per week than their age. The hours that's a rough guide, because we could go exercise for an hour and walk, or we could go exercise for an hour and do some high intensity training thing. And those are two different levels of training. So, this is where skill and experience come into play, and where the coaches are really integral. What's another aspect of overtraining? It doesn't just have to be chronic overload in terms of hours, but an acute change, in the training load is also problematic. And this happens often, and we've seen this in sports, for example, even at the professional level, when there are lockouts or whatever, and the injury rates are higher after the lockouts for particular injuries. So the same idea in a youth sports scenario is, child was away from the sport for whatever reason, season break, etc., and they come back and it's 0 to 100. And a lot of the tissues which we're talking about from an orthopedic standpoint, we think of as static, but bone is living tissue. It has to respond to stress. And so if you don't give the body time to respond to stress, then that's when you start to get structural damage that can translate to injuries. Another way that overtraining can manifest, and we often don't think about this side of it, is sleep patterns. So you can have a child that's adhering to, proper training hours, proper training etiquette, not a drastic change in the load, but they're going to another sport, or there's some other stressor in their life, whether it be school or whatever, and they're not sleeping. So they're not able to recover, even though what you think is an appropriate exposure is taking place in training. And then, so what we need to be mindful of in our children and our athletes is, if you see a change in the sleep patterns, or you see a change in just the overall child's attitude towards the sport, willingness to come to practice, you have to start to figure out, well, what's going on there? Could this be because there's some physical stressor which is manifesting itself in their mood or in their mental well-being? And vice versa, the mental well-being can have a negative impact. So what are some specific things we can talk about in injury risk factors? And we'll get into this a bit. Ensuring that there's appropriate hamstring, so the muscle group at the back of the thigh bone, and quadricep strength. So there's good balance. We have the ligaments are static stabilizers in the knee. The muscles are dynamic stabilizers, and soccer is one of the most dynamic sports that you can do. Change of direction, acceleration, deceleration, trying to complete a task while being pushed down. And so it's important that the dynamic stabilizers are balanced, or it can predispose you to injury risk. And there are even certain static tests which can help give an idea. There was a one study that looked at athletes' ability to do single leg hamstring bridges, and I'll spare you any demonstrations on this, but maybe when we have a in-person thing, we can go into this, where that can significantly decrease the likelihood of a hamstring strain. Well, you have a kid that's, oh, he's a good right footer, or he's a good left footer, left foot kicker. You want to be wary of any skill is one thing, but strength, the gross asymmetry in the strength can also predispose the athlete to injury. Foul play. So, there's been a big push about fair play, and the fair play stuff goes beyond just injuries. It's the whole approach to the game, both at the recreational and the professional level, which unfortunately everybody hasn't taken seriously. But pertaining to what we're talking about, foul play can lead to significant contact injuries, lower extremity, and concussion. The heading is one thing, but illegal attacks can lead to concussion as well as other head and facial injuries. Soccer has the highest injury rate versus other sports. In some studies in high school athletes, that's attributable to foul play. Now, it's a little bit of a difficult study to digest, because a foul in basketball isn't necessarily always truly a foul from the standpoint of being aggressive, but a foul in soccer is typically an aggressive play. So that could skew the data. But nonetheless, no one wants to see a kid get hurt because someone was just blatantly not abiding to the rules of the game. So as parents and coaches, we have to promote safe play and sportsmanship at all times, no matter what the cost is for the outcome. And, I said my son plays rec soccer, and he's just turned 7. At the time was 6. And, you'd be amazed at what you see even at that level sometimes. So players should be penalized who don't adhere, and you have to set a proper team culture. It doesn't matter if it's the star or not. Fair play is fair play. So let's get into injury prevention now that we have some background. We can't prevent every injury in the game, and we should never expect that we can do that, but we should still have a high standard and high goals. So there are intrinsic and there are extrinsic risk factors. So pre-participation physicals, this is the form and the visits that parents might, grudge having to go to every year to the pediatrician to get, but they're important. It's more than a form with check boxes. They're there for a reason. If done properly, they can identify deficits. Importantly, rule out underlying cardiac disorders. And we could have a whole session talking about that. And, should we go as far as, especially as the athletes get a little bit older, should they be getting echocardiograms and EKGs that they're doing at certain high level club stuff, some of which is not feasible at, a county level, but these are things worth discussing. The incidence of those things are not high, but they're clearly devastating if there's a sudden cardiac death or something, which could be prevented. Thor musculoskeletal exam goes without saying for sports participation. Eye exams, for example, checking on the mental well-being, and especially in the teenage female athlete, paying attention to other aspects of their health, their reproductive system health, and their nutrition, because that could be a precursor or a look into what might be happening and setting themselves up for risk for injury if the nutrition isn't right, for example. So what are concrete things that can be done? I just want to be mindful of the time, so we make sure we have some time for questions. Neuromuscular training programs, which I'll go through a few slides. A lot of these were developed specifically for ACL injuries, but the benefits go beyond that. It benefits the knee, other ligaments, other structures in the knee, the hip, the ankle. And so why devote the time to developing a program and incorporating this program into your training? Because high-level studies have proven that it can significantly reduce injury severity and morbidity from injuries. It's been proven to be effective. It goes without saying. Well, how effective is it? Why is it worth my time? Well, because it can reduce injury risk for ACLs, some of the most devastating things 50 to 88%. Now, the 88% is a little on the higher side, but most studies I've seen have said 50 to 72% effectiveness in reducing ACL injury. That's huge. What are components of a good neuromuscular training program? It teaches proper landing and deceleration techniques, muscle strengthening and recruitment patterns, proper neuromuscular warm-up, proprioception, which is kind of a simple way of saying body awareness and awareness of what position the body is and reacting appropriately, plyometrics like bounding exercises. Now, different organizations have come up with different neuromuscular training programs. Two of the more established ones are the FIFA program, 11 plus, technically for kids 14 and older, but there's an adaptation for younger kids as well, which is proven to be effective also. So it consists of 10 strengthening, plyometric, and proprioceptive exercises that can be incorporated into the warm-up. I'll show you a slide briefly with that. And it's been proven to decrease the injury rate. You know, I talked about ACL injury. This is looking at lower limb injury rate, other injuries incorporated. And it works. So this is just a pictograph. It's not meant to be, you know, a full introduction to the program, but basically just to go through it, it has running exercises, strength, plyometrics, balance exercises, and some more running type agility drills at the end. And there are 3 different columns because there's different levels as the athlete, you know, advances in levels. So it, you know, takes some time to incorporate into the warm-up, but it's worthwhile. What is it trying to accomplish? This picture here really shows what's at play. You're trying to avoid the situation where you have the knee valgus, or in more common terms, the knock knee posture, which puts the ligaments on strain when you're landing. And then imagine, you know, this is a non-contact situation, which is how most ACL injuries occur. But imagine someone leaning on this athlete as well, going for the ball, and that's what the posture looks like. It's really a setup for disaster. There are other programs with cool acronyms which have been designed. The knee injury prevention program. This particular program, you know, reduces non-contact lower limb injury and even overuse injuries in young female soccer players in this particular study by 50 and 56% respectively, with the non-contact injuries versus the overuse. So I think just being mindful of, you know, incorporating strategies, not just for enhancing performance, but preventing injury, can have a huge impact. And this is just another slide which goes in. We can always come back to this more detail about what the program looks like, but they generally involve exercises which have a similar goal. There are cool apps even, which you can get on the phone. The IOC, the International Olympic Committee, has one called the Get Set Train Smarter app, which you can get which on the iPad and iPhone, for example. There are lots of resources which are available for free that you can incorporate. Concussions, devastating. You know, growing up playing soccer, there was no ban on heading, you know, but as my son's in soccer, you know, I found out some more of the rules, in particular with banning children under 10 from heading in practice and in competition. The idea behind that is, you know, a child's head is disproportionately large compared to their body. The cervical, the neck strength is not ideal. Coordination is not developed. So something which is even a seemingly low level contact can have significant impact and change in acceleration and deceleration of the brain, which can lead to concussion. And you know, the studies don't really even truly understand what the cumulative effect of submaximal injuries like that are. And so, you know, US soccer has basically banned it for that age group. And as they get older, allowed but limited, you know, activities of heading, and then as they get older, it's not limited. So they can have the time to learn the skill and develop. So coaches obviously at the appropriate time are critical for teaching the proper technique. Kid has to have proper core strength, torso strength, and neck strength to position the body appropriately to head effectively. Having the proper ball size for the age group, making sure the ball is properly inflated, not overly inflated, and adherence to fair play, because a lot of concussions occurring in games are from foul and illegal contact. Things which a lot of resources and money is pumped into developing technology like head guards and mouth guards, not quite clear that they reduce the impact. In my fellowship training in sports medicine in Pittsburgh, I had part of our program was we had to rotate on the concussion program. And a lot of these neuro psychologists were responsible for developing, for example, the impact studies. So you really got to see what cutting edge treatment is. And, the good thing across all sports is that we recognize this is a problem. Cardiac injuries, I say injuries because it sounds, almost not severe enough to say that, when we're talking about the heart, that they're injuries. It just sounds like it's worse. But obviously, staff should have basic life support training. In competitions, you should have appropriate medical staff around. And there are protocols in place, fortunately, in the United States to make sure that this is the case. In other countries, it's not necessarily like that, and there aren't the resources we have here. Having things like an AED, an automated external defibrillator, at the facility at any practice can save a life. And proper screening. So going back to the pre-participation physical exams, and on the front of the participation exams, some people are against the mass, like where you line up the whole team and one person just runs through the team and does the physicals. Some people the American Academy of Pediatrics are strong proponents, as you would expect them to be, that it should be done by the child's medical provider who's familiar with them. And if not, that you make sure you get a detailed history, because the data won't always come in that informal setting. Lightning. So if there is lightning, then what do you do? Suspend the game if it's within 6 miles. There are all these cool, apps on the phones that can tell you how close it is, when the last strike was, and that technology should be utilized. Having appropriate shelter, resuming an appropriate time after the last strike or the last sound of thunder, and just making sure there are protocols in place. So when it comes to competition or training, there is no question. This is the situation. It's canceled. It's suspended. We'll be able to resume in X time frame. Heat injury, as the summer months come upon us, the risk is higher in deconditioned athletes, but it can occur in athletes that are well conditioned. Attire can contribute to this. If they're not particularly familiar with playing, for example, kids Northeast coming down for a summer soccer thing, they're not used to that heat. Lots of factors to take in place. And, most importantly, modifying training sessions appropriately, having appropriate hydration and rest breaks, getting the idea out there that it's not weak to take a water break, speaking of water break, at the appropriate time, and shortening the sessions or changing the time of training to be in more ideal weather. Load management. So relative load is a measure of the acute to chronic work ratio. So for example, to simplify it, if you typically run a mile, and then I'm going to get some water real quick. I apologize. Sorry. So if you typically run a mile, don't go out and run 2 miles, go 1.25. So having an appropriate increase in the workload, that became very popular with Kawhi Leonard, the basketball player, and really came into the media a couple years ago because that was integral in his performance. So Obviously, you have to have the appropriate load to build aerobic capacity and strength and not risk burning out. So open up for questions. One sec.
So there are some questions in the chat, Dr. Bullock. You'll see them.
Would you please provide a guide, whether age-based or otherwise, for appropriate training without overtraining? Okay, so to recap, the age-based guide is total number of hours participation in competition and training. Typically shouldn't exceed the child's age. So if you have a 9-year-old, they shouldn't typically be doing more than 9 hours of organized sports activity. That's going to depend a lot on what the child was doing before. So your 9-year-old just starts to play, they shouldn't be starting out at 9 hours a week. They should work up to that. And then, you know, what's critical to know with each kid coming in, for example, after an off-season break, is have they been maintaining, you know, certain training, or not necessarily in that sport, but just some physical activity. So you get an idea. So, you know, coaches, I'm sure, are adept at having appropriate tests at the start of the season. And these tests shouldn't hopefully be seen as, well, this is a pass or fail. And if you don't do it, you don't come in, unless they were given information to work towards that. So the idea, the worst scenario would be a child that's not been very active coming into a program, a drastic increase in the level of participation, you know, relatively steady training week in, week out. And then they come into competition and they're training just as much, but they're also playing, you know, 2 games a week, and then the load goes up to here. And then they go into a situation where, you know, oh, I'm trying to make out, you know, get in a college team. And in addition to what I'm doing, I'm now gonna do this weekend bonanza tournament. So you have to have a gradual increase and plan for the season. I'm a firm, Marie, can you read the last question for me while I catch my voice?
Yes, I am a firm believer that the athlete should have other physical activities in off-season. Swimming, MMA are the best. They really help, again, routine injury risk. I wish coaches would encourage more. Agree.
Yeah, so definitely. And, you know, parents have to take the responsibility with that too. And I would go so far as to say, I don't think that's the situation only in the off season. I think it's important to have some kind of cross training even during the season. It doesn't necessarily mean, like I said, that the kid has to be in another sport. It could be, you know, my son plays soccer and we're gonna go on a bike ride, or we're gonna go take a swim, or we're gonna go kayak, some other activity using different muscle groups. And so definitely. And you could incorporate it as a fun thing and have, you know, group exercises with the team, for example, where they go and do other stuff. So, you know, I used to swim at some point, and our swim team would, at a certain stage in the season, we would go running. So that's an example.
I was going to say, if anybody wants to ask a question, just unmute yourself.
Yes.
Yes. So play during COVID and into travel for, yeah, you know, that's a great point, that last point, which was privately transmitted by you there. You know, to get into a few other recommendations, some sporting bodies and youth sports organizations, you know, really are proponents that a child should have a rest for a total of 3 months a year from the organized sporting activity. It doesn't have to be 3 consecutive months, but you know, even 3 separate 1-month spurts throughout the year where the child is not playing the organized sport. And And it doesn't mean that in that time they have to be completely away from the sport. They could, you know, develop some skill, but not to the same level of training intensity. And, you know, the whole idea of just, you know, doing some exercise, even not necessarily for the particular sport, it can be beneficial. Make it a family experience, have them go do something with their friends outside of that sport. You know, lots of ways to be creative, because you don't want to make it seem like a chore, and you don't want to make it seem like you're discouraging their interest in the sport. But at the same time, you have to look out for their well-being and the longevity of their football career, their soccer career, if it's something they're really interested in. Because burning out at 12, they're not going to, you know, they're not going to be a star at 16. And so COVID has obviously made that difficult, because in a lot of places, and I even think in Florida, it is nowhere near as bad as other places. You know, I have a nephew in Jamaica, and school was completely out for like 2 years, and no, or very restricted organized sports. You're talking young teenage boys, and then they, you know, you know, it's really a tragedy. And you know, but it's something that was unavoidable for a long time. And then their interest is really high coming back, and what they recall is what they were doing 2.5 years ago. And that's when you have to kind of pull the reins back and be like, we're going to slowly get back into this. So yeah. Any other questions? Feel free, don't be shy. You can unmute and ask the question, or type it in. We have 6 more minutes if we want.
Some of the parents want to know if you have handouts, Dr. Bullock, that we can send out to them.
Sure. I mean, I have no problem making the slides from tonight available, and I can put some useful links into it as well. There are a lot of resources, for example, from the American Orthopedic Society for Sports Medicine and the Stop Injuries Initiative. I'll put together a thing which can have the slide. We can have a link to the video from the talk, and some useful things. And in the research for the talk, I actually came across a lot of online guides from different soccer organizations about, you know, how to be a good soccer parent, for example. Most of which I'm sure a lot of us know, but it just lets us stop and pause and think about it. And, you know, I know we're talking about injury prevention, but in addressing injury prevention, we're going to be able to keep the athletes at their peak performance, because, you know, the last thing you want is an injury, because it can affect the whole team and the individual tremendously. It can be a huge healthcare cost. It can be a huge family burden. It's a psychological stressor, you know. And while we're not going into that today, you know, if you know, unfortunately there is an injury, then trying to keep the child integrated as much in their team mentality and with their team is good for the recovery. So I hope this is just a start of, you know, a series of talks which we can do and an exchange, and, you know, hopefully an open-ended thing where if there's certain things you guys are interested in, we can address. Where can we find neuromuscular training? Excellent question. We have a physical therapy department, and developing something like this is something which I have a huge interest in. There's established data about the things that work, and I'd be happy to talk with Lee to see how would be best for, you know, the particular population of players that we could do something like that. Because yeah, I think it's good for performance, and it's great for injury prevention, and it can be easily incorporated. And the big thing with the last point is with the injury prevention stuff, with the neuromuscular training, it's not just doing it and incorporating it, but to maintain the benefits of the program, it has to be reevaluated. The kid has to move up to the next challenging level of stuff. And it takes a lot of work from parents and coaches and key players to maintain the interest in continuing to incorporate those exercises, because most studies show after stopping incorporating that in the warm-up and in the training routines, that the injury prevention benefits decline. So it's hard to keep, you know, like you got to keep doing this. You just have to make it a part of the routine training program. So yes, there are certainly benefits and studies which have shown like 6 to 12 week intense programs helping, but if it's not maintained, then the benefits of the programs are going to decline. So I can identify some of the resources for the neuromuscular training and make that available. Does the practice see youth? It's often hard to get into a pediatric ortho in a reasonable amount of time, which makes it hard to get answers quickly. Yes, and admittedly, you could even remove pediatric from in front of ortho, and it can be challenging to get in because it's a field that's in demand. But yes, we do see youth. Obviously, you know, so as a sports medicine subspecialty trained orthopedic surgeon, all those programs, you know, to be appropriately recognized sports medicine fellowship, you have to have exposure to youth sports. And so, you know, some people do go out into practice and not see pediatric age group. We definitely see adolescent and pediatric. There's certain injuries which might be best handled by someone who is, you know, just in pediatrics and not doing adolescent and adult stuff. We're certainly capable in our practice of evaluating a child. I personally have a strong interest in seeing, you know, young athletes. So yes, we can certainly help, and Marie can get any resources.
Yes, I gave everyone my email. Everyone who has any additional questions, please, but also follow the practice on Instagram, on Facebook. They do a lot of, you know, tips for parents. We're always kind of putting stuff out there as well. If you subscribe to the website, there's newsletters that will come out that you can also have a lot of, you know, injury prevention information that will be sent directly to your inbox. So it's a good resource, having us in your website.
And this is like a removed session. My hope is that in the future, we can do this somewhere like, you know, in person, and we can have some of our PT personnel out, and we can get a little more hands-on / demo type stuff going as well in the future. So yeah, again, thank you very much, Lee. I really appreciate it. And hopefully we can bring value to the program. You know, it's not just about, oh, this is our practice. This is, you know, a long-standing relationship that we'd like to build. All right.
That's our intention.
Thank you. All right. Good. Okay. Well, if anybody has any burning questions after, please send to Mari. She'll forward on, and we'll answer it on the Instagram, on social media, or directly. Appreciate it. All right.
My email there again, just for everyone, and then OCSF Docs on Instagram and Facebook as well. And the same as the website, Orthopedic Center South Florida. If you Google that, you'll find the practice website immediately.
Okay.
Thank you, everyone.
Thanks for your time, everyone. Have a good night. Take care.